Good afternoon, everyone. It's 2 o'clock and time to start today's briefing. Joining us today, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, and Marlena Jackson, Interim Commissioner of the Milwaukee Health Department. County Executive Crowley, you're starting us off today.
Well, thank you so much, Sydney, and good afternoon to everyone. Thank you for joining us. So last week, Thursday, Mayor Barrett and we really discussed the need for flexible and direct funding at the local level that was needed to be included in the federal relief bill. And what we've seen over this weekend is that Congress did come together and pass a $900 billion stimulus package. And this package includes direct payments to Americans, those who are unemployed with jobless benefits, funds for businesses, and vaccine distribution. But the bill does not address the state and local relief that is so much needed, as we talked about. And while I'm very pleased that there's some relief coming, I do have some concerns about there not being any direct assistance for state and local governments, and the need for health services, for housing assistance, business aid, and more support programs isn't going away anytime soon. I mean, we actually think about it, in fact, the need is only going to grow as this pandemic continues to take its toll on our community. And so counties, all counties, including Milwaukee County and across this state, we really need support from our federal partners to keep up this fight against COVID-19. And so I'm asking you all to join me in the continued effort in urging our Wisconsin congressional delegation to support immediate relief for municipalities like the city and Milwaukee County when we think about a federal COVID-19 aid package. And this is really to address these growing needs. And in order to do that, they must act fast. And so I look forward to working with our federal partners on a robust and bipartisan package that will enable state and local governments to adequately address the economic and public health challenges that have been created by this pandemic. Though the gaps in the current bill won't go far enough to mitigate the hardships caused by the pandemic, this week it will also has me feeling hopeful that we're turning a corner in fighting COVID-19. And so as of today, we have actually received our first doses of the Moderna COVID-19 vaccine to be distributed to our employees at a Milwaukee County Behavioral Health Division. And these employees are identified in Group 1A that has been discussed, which includes healthcare workers providing direct patient care, will be among some of the first to access this vaccine. And though we know that this batch won't provide enough for all eligible department employees, we do expect to receive more shipments of the vaccine in the coming months until all staff who at least want to be vaccinated are able to. And so, we do know that we still have a long road ahead of us, but the near arrival of these vaccines provide me a bit of hope and anticipation in going into these last couple of weeks of this year. And when we think about this year, we only have a few weeks left, and we're heading into another major holiday. And I believe that hope is more important now than ever. And so while we celebrate these holidays, it's going to be different, and we know that going into this. And so I believe that there's reason for us to be hopeful as we head into this next year. And so please remember to stay safe as you celebrate this week. Remember the 3 W's: wear a mask, wash your hands, and watch your distance. And I wish all the folks here in Milwaukee County a very merry holidays. And I hope you all stay safe again. So with that, I'd like to hand it over to Mayor Barrett.
Well, thank you very much, County Executive Crowley. And with your young family, I hope it's a great Christmas at your house. So I'm sure it'll be busy at the Crowleys. Earlier today, I visited Miller Park along with Commissioner Jackson to talk about testing at Miller Park, and testing particularly because of what we've seen over the last 6 or 7 weeks. When we opened Miller Park, we had, not surprisingly, a real rush of people who came for testing, and that peaked around the Thanksgiving time. Since Thanksgiving, we have seen a pretty continuous drop in the number of people being tested at Miller Park, and that's concerning to us. It's concerning to us because although the positivity numbers are down since the peak around Thanksgiving and a little before that, we still are considered a community and a state where the numbers are extremely high. We're still above 10% here in Milwaukee County and in the city of Milwaukee. And it's important, given that high number, that number above 10%, that people continue to get testing. So the reason we made the stop there was because we want to highlight the ease of getting tested at Miller Park. I want to point out that it will be open on Christmas Eve. It will be open on New Year's Eve. The only days it will be closed are actually Christmas and New Year's. Neither our Northwest Health Side Center or our Southside Health Center will be open on Christmas Eve or on New Year's Eve, or Christmas or New Year's Day for that matter. But Miller Park will be open on both those days. So if you are feeling the symptoms of COVID-19, or if you've been exposed to someone who is tested positive, and unfortunately, as time goes, more and more of us are being exposed to someone who's testing positive, please make sure that you take advantage of this wonderful, wonderful amenity we have in our community. Getting a good COVID test would be a pretty nice Christmas present. And I think it's something that all of us should consider. The lines are not that long. They were not that long this morning, maybe 20 minutes to a half hour. And so you get your results back very, very quickly. But we saw numbers as low as 1,100, 1,200. Fortunately, yesterday, the numbers crept up a little bit. We had just under 2,000. We had 1,994 at Miller Park yesterday. At the Northwest Side Health Center, we had over 500. On the South Side Health Center, we had over 300, just under 400 actually. So again, we strongly urge people to continue to get testing. Part of my concern is with more and more in the news about the vaccinations, we have a human tendency just to let our guard down. But I think as you'll hear from Dr. Weston and Commissioner Jackson, this is no time to let our guard down. In fact, this is sort of the final push, if you will, the next 6 months, I would say. I'd like it to be shorter than that, but I think the next 6 months where even if you are fortunate enough to receive the vaccination, you still need to be wearing your mask. You still need to be taking the precautionary steps. But clearly we're seeing in our conversations with the state, and the county executive just referenced it, we're starting to see both the Pfizer and the Moderna vaccinations reaching our community. And as expected and as is appropriate, they're going to our frontline healthcare workers first. So I'm very happy Dr. Weston got his vaccination. I think that that's very, very important. The people who are taking care of the patients are the ones that obviously I think need to be in a place where they're safe for their own sake and for others' sake as well. I'm also pleased as the federal government looks at the next group that includes first responders like the police officers, the firefighters, the mail carriers, people who work in grocery stores. And on a personal note, I'm happy it includes teachers, since my wife is a 5th grade teacher, and I would love to have her be vaccinated as well. So we know that there's a lot of work to be done. I just ask people to be patient. And the holidays, I think we all recognize, are going to look a little different this year, but there are still so many ways to celebrate safely. If you do gather with others, please do so wisely. Keep your gathering small and stay local. Stay outside if possible. It's going to be 50 degrees tomorrow, I think, but then it's going to get mighty cold on Christmas Day, Christmas Eve and Christmas Day. But also try and avoid contact with non-attendees for 14 days before and after your gatherings. It should go without saying, but I'm going to say it again, particularly with Christmas and New Year's, avoid large gatherings, especially indoor gatherings. Shared food, avoid shared food, avoid crowds and contact with anyone who is sick or who may have been exposed to COVID-19. And don't risk the chance of COVID-19 being on your guest list. You don't know who has it, and nobody is intentionally spreading this around, but it's obviously still a very, very high concern for all of us. So this year, plan to pick up or drop off gifts to loved ones safely and catch up virtually. Keep your loved ones safe by wearing that mask, keeping 6 feet away, and washing your hands frequently this holiday season. So from everyone at the City of Milwaukee, we wish you a safe and healthy holiday season. And with that, I'll turn it over to Dr. Weston. And I know he's got young kids in his house, so it'll be a busy house there as well. Dr. Weston.
That's right. Thank you, Mr. Mayor. Good afternoon. First to our numbers, we have 81,243 confirmed cases of COVID-19 in our community and 838 individuals who've died in Milwaukee County. But we continue to see promising downtrends in our cases, our positivity rates, and our hospitalizations. Unfortunately, the daily deaths from COVID remain high, but if our hospitalization trends continue to decline, we're very hopeful that deaths will soon fall as well. These trends are encouraging for this time of year and considering what's going on in other parts of the country. We're no longer a house on fire that we were a few weeks ago, but we are surrounded by a neighborhood on fire, so we can't get too complacent. Additionally, it's important to remember that throughout the pandemic, we've seen ups and downs. We happen to be in a downtrend at the moment, and that's due in large part to the vigilance of the public. But that can easily turn around. We must maintain the level of caution if we are to sustain these promising trends. And by continuing our precautions, we can position ourselves to get the best outcome possible from the introduction of the vaccine. As we go into another major holiday, we once again have a different sort of celebration than in the past. For the summer holidays, we were able to gather outdoors and distance safely. And for Thanksgiving, the recommendation was to stay as distanced as possible. Well, for the upcoming holidays, that still certainly holds true. The safest gatherings will be virtual, and they will be different than any we've experienced before. However, what has changed is that with the introduction of the vaccine, we can now take what may not quite be the typical season of joy, but we can make it into a season of hope. Across the country and across the state, while we're seeing devastating levels of disease and suffering, we're also seeing the promise of a vaccine, an end to this terrible chapter in our history. On Friday, I worked in the emergency department and I saw my colleagues and I felt in myself a sense of levity, unlike I've had in over 9 months. And after that shift, I received my first dose of the COVID vaccination. And it really was incredible to be in that room surrounded by other frontline healthcare providers receiving their vaccines. Many of them smiling, many celebrating, some tearful, but all hopeful. And we've seen the photos, we've seen the videos of that pleasure from our healthcare workers, that satisfaction, that honor of receiving the vaccine. It really is humbling to receive. I feel privileged to be one of the first to get it. And I can't wait for all healthcare workers, all EMS providers, those in long-term care facilities, our essential workers, those at high risk, to receive it as well. And eventually for the general public too. So this week, gather virtually with those outside of your household, reach out to those alone, talk on the phone for hours, watch a movie online together, celebrate together, and make this a season of hope for our future, a future soon to come together in person, making up for a lot of lost time. Thank you very much. Happy holidays and stay safe. And I'll hand it to Commissioner Jackson.
Thank you, Dr. Weston. So I want to start by just reiterating the holiday testing information as it relates to Miller Park, Northwest Health Center, and then Southside Health Center. So just as a reminder, Miller Park will be open for its regular business hours, except for the two actual holidays for Christmas holiday and then New Year's Day holiday. Outside of that, the Monday through Friday, 11 to 6, Miller Park is open. And then Saturdays from 9 until 3 o'clock. Our Northwest and Southside Health Centers will be closed on Christmas Eve and Christmas Day, as well as New Year's Eve and New Year's Day. Outside of that, those two sites will be open as well. So as you prepare for the holidays, as Dr. Weston has already shared, it still is safest at home. And we know, and I can tell you here at the health department, we've received calls and notifications of individuals who want to celebrate safely. So I am grateful for those calls and those questions. And knowing that that's the case, that there are individuals who will gather, know that in those spaces, it is still better if you are in smaller numbers than what you usually are, and that your duration and time is shorter than what it usually is. So be mindful of that, be mindful of your distance, be mindful to wash your hands, be mindful to wear a mask. And again, knowing that the safest place for you to be is at home with the people who you live with. I just also want to just reiterate again with the testing that we are still encouraging individuals that are symptomatic or have been around individuals who have tested positive with COVID-19 to get tested. The sites are available and they do have capacity. And now I just want to share a little bit about the vaccination preparation as it relates to the City of Milwaukee Health Department. And I want to start by sharing that the concept of nationally vaccinating individuals at the scale and the level that we are looking to do is massive, and something that is really historic in nature. So we are working very closely with our state partners to make sure that the city of Milwaukee has a seat at the table. I am grateful for Mayor Barrett and his support in this way. And so that when we are ready as a health department for the city of Milwaukee to vaccinate those individuals that are appropriate, that we, our systems are set up, our processes are set up, the funds are there for us to do this work. So knowing that that's the case, we also want to share that this process, because it is such a large scale and because this is new vaccine for a new virus, a lot of it is fluid, which means that there is going to need to be patience and understanding and flexibility, because things could and might change. When we look at where and how vaccine might be given, whether it's given in a healthcare setting or given in a clinic setting or given in a drive-through setting, all of those things we are planning for. We're planning contingencies, plan A, B, and C. And so we'll continue to do that work. And as information becomes available, which things are coming available daily, we get new information. So as that information becomes available, we'll be making sure to share that with you. So with that being said, I'm going to turn it over to Sydney and tell everyone to please have a safe and happy holiday.
Thanks, Commissioner Jackson. Our first question comes from Patrick Palantonio of WISN 12 for County Executive Crowley and Mayor Barrett. Without additional federal funding, is time winding down for the community COVID testing locations? How much longer, will you be able to keep them open?
Well, time is not running out on the community testing locations because one of the provisions in the legislation that passed basically today is a continuation for using CARES Act money into 2021 that otherwise would be forfeited. We have been doing a lot of work at the city level to make sure that we have a good control over whether the spending is under the CARES Act. And fortunately, we will have some dollars that we can put the brakes on to use. Now, how far into 2021 we'll be able to go, I can't guarantee right now, but it does provide the health department with some flexibility that they otherwise would not have had. So I'm very, very pleased to say we are going to continue the testing there. Obviously, we also are hoping that there will be more legislation coming to deal with testing in particular. And I share the sentiments of County Executive Crowley that the major disappointment in this legislation is the fact that they omitted any specific help for local governments or state governments. So that issue still needs to be revisited, and testing is at the top of that list. But we feel confident at the city that we'll continue to have this partnership and be able to continue this for the foreseeable future. Again, I can't give you an exact date as to how far we can go, but we're going to try to stretch this as long as it makes sense for us to do that.
I think the mayor summed it up perfectly. We're going to continue to have this partnership as long as we can. And again, we're doing this in conjunction with the city of Milwaukee.
And we appreciate the county's partnership very much.
Absolutely.
Our next set of questions come from Sharon Bajenda at CBS 58. What systems are put in place to make sure people keep track of which vaccine they got and then come back for the second dose? Are you familiar with the CDC's vSafe app? If someone misses their second dose, do they have to restart the vaccination process? And then the final question related to vaccine for this round. Health experts say vaccine hesitancy is prominent in certain population groups. Is this true, and why is it important that these groups get vaccinated?
So maybe I'll start and then work my way backward, and Dr. Weston can finish up. So as it relates to particular groups getting vaccinated, so one of the things that the health department is acutely aware of is that Black and Brown individuals in the city of Milwaukee, and just historically, have been less likely to get vaccinated for any vaccination. And there's lots of historical context and reasoning for that. I think the importance, though, is to understand COVID has exposed what we've already known around how disease and sickness affects Black and Brown people. So they are typically diagnosed first. And in that diagnosis, they are hospitalized at a higher frequency, which means the sickness or the illness is more severe for them. So it's that reason alone that it makes a lot of sense for individuals of color to make sure that they are aware of the vaccine and when it's available for them, and also talking to their care providers. Talk to your doctor, have real conversations about, should I get this vaccine and when I should get it. And then I'll let Dr. Weston answer the other two.
Sure. So for the systems in place, so right now it's mostly health systems that are providing the vaccine, and they're carefully tracking who gets the vaccine when, which vaccine they're getting. And then typically, so in my case, for example, I scheduled my appointment on Friday to get the vaccine, and I already have another appointment scheduled early January to get the second dose. So it's very carefully coordinated to make sure you get both doses. And then as far, oh, I lost the question. As far as the CDC vSafe app, yeah, so this is an app to help the CDC track any sort of symptoms, any sort of adverse effects that people may be having from the vaccine.
There was one other question about, if someone misses their second dose, do they have to restart the process?
Sure. So it's being very carefully monitored to ensure that you get your second dose. There's a certain time period you can get it in. There is a process for catch-up dosing if it is missed, but hopefully everybody will stick to the timeline as much as possible and get their second dose to maximize their immunity boost.
Our next question is from Ashley Sears at Fox 6. Can you tell us how many people in Milwaukee County have received the COVID-19 vaccine so far?
So we don't have the exact data yet, and that's something that we're working on, is getting the data, making that data transparent. I'm told probably in the next 1 to 2 weeks, we'll have much more detail with both the number of people receiving the vaccine, as well as the specifics on the demographics. But each day, each hour of the day, it's ramping up very fast as health systems are working to get as many people as possible, those frontline healthcare workers, vaccinated. And then certainly moving on to the other 1A groups, which is our EMS providers throughout the county. And then those living in or working in long-term care facilities are also part of that initial group. So they should see the rollout in parallel with the healthcare systems.
Our next question is from Ben Wagner at WISN for Mayor Barrett or Dr. Weston. Why do you think we're seeing a drop in testing even as the holidays approach?
Well, I think we can both guess on that. Go ahead, Dr. Weston. Looks like you're keyed up.
Sure. So, it is a guess. And I would say probably the reason we're seeing that is because of the general trends we're seeing. And so this has been an ongoing cycle with COVID where trends go in a wrong direction. We see increased positivity. We see increased hospitalization. We see increased discussion around the hospital capacity and the strain that it's having on our community. And everybody buckles down as far as personal interactions and going outside of their household. And people are more aware of their symptoms. They're more cautious with their interactions, and they're more likely to go out and get tested. We're on a downslope right now, which is great. It's encouraging. I hope we can sustain it as long as possible. But when you have that downtrend, it becomes less on your mind to think about COVID. It becomes less on your mind to go get tested. We know from looking at syndromic surveillance, that is how many people out there have symptoms and present to our clinics and our emergency departments with symptoms. We know there's a lot of folks with symptoms who are not getting tested. And that's what we really need to focus on. So there's a few groups that we want to get tested. Anybody with symptoms, anybody with close contact, anybody who's referred. But that symptom group in particular is really important. So anybody with symptoms of COVID, which can be as minor as a mild cold to as severe as chest pain, cough, shortness of breath, fevers, need to get tested. And luckily we have lots of capacity. We have lots of opportunity to get quick, efficient, and rapid turnaround testing.
Another factor that I think comes into play is on the nightly news, for example, instead of hearing more and more about hospitals being overrun, we're hearing about all the great news with the vaccinations. And I think hearing all this great news about the vaccinations leads many people to think, well, we got this covered. We're just on our way out of this pandemic right now. But as we have said repeatedly, the rollout of the vaccinations is going to be a multi-month process. And while we are trying through all sorts of avenues to roll out this vaccination. That is going to be dependent on the production, the distribution channels, and not everybody's going to be able to get it at the same time. So that means that we still have to be on guard. But again, because we're hearing more good news than bad news, I think that Dr. Weston is right. We're letting our guard down, and this is not the time to let your guard down. This is the time to, come on, let's get through this. Let's get through this.
Our next question comes from Allison Durr at the Milwaukee Journal-Sentinel for Commissioner Jackson. Given the partying that traditionally comes with New Year's Eve, especially if establishments can stay open all night, why will the health department be relying on complaints and not doing spot checks that night? Also, if the department gets a complaint about an establishment, will members of the health department respond that night? Will police be involved in enforcement?
Thanks, Sydney. So I think we shared a few weeks ago now that the Milwaukee Police Department has offered to escort our health department staff on inspections as it relates to COVID-19 order violations. So that's something that we're continuing to work through from a scheduling perspective, and that is why we are doing all of our enforcement right now based off of those complaints. As I've shared before, really for those restaurants and bars that have safety plans in place, those mitigation steps are really meaningful. Even if a place is going to be open, if those mitigation steps are in place, we do believe that that's one layer of protection.
Our next question is from Mary Jo Ola at TMJ4 for our health experts. The governor just announced Wisconsinites can request a free at-home COVID test. What are your thoughts? Is this something that's needed?
So I can start on this one. I think it's another layer to the testing infrastructure that we're working to develop. And I think it's a welcome layer. So the at-home tests have several advantages. One is just that they're at home. They're very convenient. You swab yourself a lot of times on video with a provider who can show you how to do it. You send it in and then you get your test result back. It's quick, it's easy, and you don't have to leave your home. So those are the benefits. The downside, of course, is that it's just not quite as sensitive as the tests that we're doing at Miller Park and at the Milwaukee Health Department sites and the South Shore site and the healthcare sites. So it doesn't have quite that same level of accuracy and of sensitivity of those tests. So you may get more false negatives, you may get more false positives, in particular, probably false positives. But nonetheless, it is an added layer of testing. And for large population-based testing, it's going to be, I think it'll be a benefit.
Our next question comes from Ben Wagner at WISN for County Executive Crowley. You mentioned county workers are getting the Moderna vaccine. Do you know when that's happening? How many doses does the county have of the Moderna vaccine?
Thank you for that question. We just received the doses today, and if I'm not mistaken, started being distributed today. And we received for 100 doses of the Moderna vaccine up to date.
The next question comes from Sari Lesk at the Milwaukee Business Journal. Other than testing, what are the city and county's priorities for any remaining CARES funding? How much CARES funding do you each have left right now?
Well, I can tell you, we obviously want to continue our tracing efforts as well at the city. So some of the funds will go toward that. And like the county executive, I'm very, very concerned about the issue of evictions. So to the extent that we have dollars available, we are going to want to be able to do everything we can to make sure that we're dealing with those issues as well. So issues remain that we will very, very, very easily be able to use this money in a fashion that I think is productive for people in our community.
I couldn't agree with the mayor more. We've allocated a majority of these dollars already. We want to continue to invest in what's already on the ground. You think about eviction prevention. We've recently allocated dollars to arts programs right now that have been struggling due to the COVID-19 pandemic. But we have less than 2 weeks left, and so it's not much that we can infuse right now. But the goal is to, again, continue to hammer to the public about the need to contact our congressional members and urge them to pass something, particularly for state and local governments.
Our next question is from Sari Lesk at the Milwaukee Business Journal, a follow-up question for Commissioner Jackson. To return to the question about New Year's Eve, if the health department gets a complaint about an establishment on New Year's Eve, will members of the department respond that night?
That's going to be the goal. It's again, there's a scheduling issue and then just a monitoring. So that would be the goal. Yes.
It appears we're coming up on our last question. As a reminder to media, please continue to place questions into chat if you'd like to ask anything else. Our next question is from Patrick Palantonio at WISN for Dr. Weston. Can you describe your experience in the hours and days after receiving your vaccination? Any side effects, and what do you want people to know if they are hesitant about receiving the shot?
Sure. So I had a great experience with the vaccine. I honestly barely felt it as it went in. The nurse was great. She squeezed my arm nice and tight, so I didn't really feel it. And then the next day I had a slight amount of arm soreness, kind of similar to a flu vaccine. Not quite as bad as a tetanus vaccine for people that remember that, but similar to a flu vaccine that lasted maybe 4 or 5 hours. And then I felt great. I had no other symptoms. I went for a run. We did work around the house, hung out with the family, and had no other symptoms. So from a small sampling of my colleagues, I haven't run into anybody who has had symptoms more than arm soreness and some mild fatigue. And when you look at the studies, the tens of thousands of people that were vaccinated in the phase 3 trials of the Pfizer vaccine as well as the Moderna vaccine, some do have side effects. It's less than 50% that have any sort of, headaches and body aches and things like that. And usually they last for about a day, and it's within the first 24 to 48 hours of getting the vaccine, and then they resolve. The severe side effects have barely been reported, but as with any medication, as with any immunization, there's always a chance of some sort of adverse reaction, but they're extremely low. And to the question of what would I say to the people who are hesitant, I would say that you really have to weigh the risks and benefits. Getting COVID, getting the virus COVID can be dangerous in the short term. Whether you're healthy or not, it can certainly be problematic in the long term. Even in healthy 18 to 34-year-olds, we see 20% of them having long-term side effects that are lasting weeks or months. Chronic fatigue, chronic headaches, chronic body aches. And so I understand the vaccine seems like somewhat of an unknown. It's an mRNA vaccine. We haven't had a ton of experience in that in the past, although there's been a lot of research and development that have gone on with it. But I think it's also important to remember that COVID is an unknown. There's a reason it's called a novel coronavirus. It's because we're still learning about it. The long-term effects on the heart, on the kidneys, on the brain, on the lungs. We're still learning about all that. So I'll tell you, every one of my frontline healthcare worker colleagues that I've talked to is jumping at the chance to get the vaccine. We were randomized to who would get it first and who would get it in the second wave. The people in the second wave were not as happy to be in the second wave as those in the first wave. And so everybody that I've talked to who's on the front lines is jumping at the chance to get it. So I think it's a risk-benefit conversation, but certainly I think the benefit of the vaccine far outweighs any perceptible risks.
We do have an additional question from Christina Flores at CBS 58 for County Executive Crowley. Apparently your audio cut out just a little bit. How many vaccines did the county receive?
Milwaukee County received 100 doses at BHD.
Thank you. Any further questions from the media? It does not look like we have any additional questions. That concludes our briefing for today. A reminder that there will not be a briefing this Thursday. We'll see you back here next week. Happy holidays and stay safe, everyone.
Thank you very much.
Happy holidays.
Thank you. Happy holidays.
Happy holidays.